Welcome to Safety Matters. I'm Walt Seigan, Safety Engineer Consultant, and Ron Smolarski from Beacon Rehabilitation is going to be talking with us today on work capacity evaluations and some of the yardstick definitions that go along with those evaluations. Ron Smolarski, welcome to Safety Matters.
Good morning.
Tell me a little bit about the definitions about these work capacity evaluations and how they compare within requirements, if you will, like the ADA and the Michigan handicap laws.
Well, the important thing is that under the ADA and the Michigan Handicap Act, evaluations have to be job specific. Workers' comp doesn't require job-specific evaluations. And in the past, they've only required doctors to give their opinion as to what they felt a worker can or cannot do in terms of work once they're injured, such as a back injury or a shoulder injury. And the federal government in the state of Michigan, when they developed their laws, they says, no, this is discriminatory. And it's a way they want to get injured workers back to work, and so by implementing these laws, ADA and Michigan Handicap Act, they've asked for ways of describing a job and a person and how they're able to still work, and that's what work capacities evaluations are all about. They describe what a person is capable of doing.
Well, maybe we should back up just a little bit to what the requirement is as far as the person being treated by his employer's clinic or physician. Isn't it a part of the law that the employer will treat for the first 7 days?
Yes.
And then after that, if the employee wishes treatment by others, that's his option.
Well, under the workers' comp, they have a right to pick their own physician, but only after 7 days. The first 7 days, the employer can pick whatever physician he wants to work on with that individual under industrial injury. And then after that point, they can request a doctor of their own choosing. Also, even in even no-fault laws, they have certain rights that they can request physicians of their choosing.
Okay. And in a situation that goes beyond 7 days, then the employee can request a general practitioner or somebody of his own choosing. Could even be a physiatrist, correct?
Well,
to care for
not
him?
Exactly. I mean, for instance, if a person has a hand injury, a general practitioner was, would that be working against the insurance company or self-insured, or what they call TPA, third-party administrators, idea of what is that professional that should be working on that individual. A hand injury should be taken care of by hand specialists.
Okay.
If it's a bone injury, it should be an orthopedic surgeon. However, what a lot of HMOs are requiring is that the primary physician be the individual that's writing the prescription, or else the health provider will not be compensated. So the primary physician does have to be tied in with the recommendations of therapies. But for instance, as an example, let's just say a person injures their back. Well, the primary physician might be the general practitioner, and he may request that a physiatrist, which is a doctor of physical medicine, evaluate that individual to determine what types of therapies are needed. So there's a sequence of professionals that need to be contacted.
Okay, and then it would be incumbent on the general practitioner, based on the feedback from his patient, to suggest or from his patient to know that something else needs to be done. For example, suppose an IME, independent medical examination by the employer, results in a conclusion that the employee still feels is not appropriate. At that point, can he go back to his general practitioner person and say, I think I need a physiatrist?
Well, he can suggest it to his doctor. If his doctor feels that that's an appropriate referral, he can do that and get his own independent evaluation from another doctor. He may even want to get two doctors because just to compensate for whatever the other side's saying, because now you're going to have two opposing sides, one saying there's nothing wrong with you and another one saying there's everything wrong with you, and it's really somewhere in between all that.
I see. Now, it used to be, I understand, that independent medical examinations were the way to proceed, or at least that was common among insurance companies or self-insured carriers or third-party administrators. But now, is there something about that that's inappropriate?
Well, yeah, there are some concerns because under the ADA, Michigan Handicappers Act, there has to be job-specific evaluations that are carried out to make a determination if a person can perform the essential functions of a job. And of all the IME carriers that I'm aware of, they usually just have a medical evaluation, which means that a MD or DO is performing a 20-minute to half an hour evaluation and making a determination if a person can go to work, but it's not a job-specific evaluation, which the ADA requires and the Michigan Handicappers Act requires.
Now, with those requirements, that doesn't mean that we're talking only about handicapped people. This means for basically any type of job description, correct?
Well, yeah, I mean, even for a new employee, for instance, if an individual is looking to be hired by a company, after he's hired, the employer can maybe do a work capacity evaluation, or they can have a doctor do an evaluation. I'm not sure if I'm answering your question here, but they can request that type of evaluation after they're hired.
Okay. Yeah, I think that's beneficial because I think up to this point, this might be something that a worker might be exposed to, where the results of an independent medical examination come out one way, and here again, I don't think that that's as directly related to job specific as what you've suggested it should be.
Right, and in fact, I'm meeting with the head of the EOC and some magistrates into this week just to address some of those issues, because the EOC is aware of the fact that that's pretty rampant in this state, and it's something that's it's slow in changing because there's something like 600,000 cases of ADA cases happening per year, so that's a lot of cases to try. So they're trying to smooth some of those cases away from going to court all the time by trying to educate the people that have the most involvement, which would be a magistrate, because they can make changes. If they say, hey, this has to happen, well then I think the carriers might say, wait a minute, we've got to do different types of evaluations here.
Okay.
So it's been slow in changing. I think in everything that happens in our society, it's when they make laws, it changes over a period of maybe 10 years, not overnight.
What is this concept about what constitutes a direct threat, and maybe you can explain that?
Well, direct threat is a term used under the ADA, and it means that a person has to have a imminent danger if they were to return to work to their body or to someone else. So, for instance, if a person had a rotator cuff injury, and if they were to return to work, it has to be something that's going to happen within minutes of doing their job. It can't be that possibly they might injure themselves 6 months down the road. It has to be, it's pretty specific. So direct, and there's more to it than that, but in just real simple terms, the direct threat means that's to be imminent danger to an individual, or someone else might be injured as a result of that person maybe not handling maybe some equipment properly, and as a result they get injured.
Now, you also mentioned earlier a job-specific examination in line with the requirements of Michigan Handicappers or the ADA. How does that impact a person, let's say if you had a teacher involved in a situation like that? Because I know a lot of employers today really do not identify properly the individual parts of a person's work in terms of percentage of lifting, percentage of walking, or the amount of weights that might be lifted and so on. So this concept of job specific, I think, is something that employers need to get up to speed about, perhaps from the standpoint of a physiatrist, as you've indicated before. But how does a person identify that concept of job specific? Let's say if you, there must be some ways of looking at this. If there was a part of that element that said 25 pounds lifting, could you break that up possibly?
Well, there's two things you have to do. You have to measure the worker, and you have to measure the job and see if you have a match. And what that means is you do a work capacity evaluation and you do a job analysis. And the federal government has already analyzed all the jobs in the American economy, and there's over 12,000 of them, and they've already have what's called worker traits or variable. This is like a recipe to a cookie. It would be like a recipe to a job. You have to have all these ingredients for a person to work competitively in a particular occupation. So for instance, a dentist has to have very high levels of fine finger dexterity, whereas maybe a warehouse man has to have high levels of overall strength. Well, you can see that each recipe is different for each occupation, just like the cookie recipe.
Sure.
So that is then compared to the work capacity evaluation. So for instance, when you measure a person's manual dexterity or fine finger dexterity for a dentist, and I measure this doctor he maybe had an injury, auto accident, and now he can't work at a competitive rate. Well, that means that he's not going to be able to work as a dentist anymore. His level of fine finger dexterity, he might be able to use his fingers, but he can't work at a competitive rate, and also, very importantly, at a sustained rate. Those are two important variables, and so when you're combining these two, the job analysis, this evaluation of this job, and the work capacity evaluation, the evaluation of the worker, you're seeing, hey, do we have a match here, or is there not a match? And so, to answer your question, that's what you would need to do.
So this then would go beyond the independent medical examination, as you have described it.
Yeah, you're looking at the job and you're looking at the person to make determination. The medical evaluation tells you organically what's wrong with the person. I mean, does this person have a fracture? I mean, does he have a tumor? I mean, there's all kinds of things that medical doctor can tell you, but that's medically, organically, physically, what's wrong with that person.
I see. So that really all he's doing is in an IME comparing that person's medical capacity from a medical standpoint, and not really can he do the job, because you're not fitting in his physical condition to the job requirement.
Right, you need to have some sort of standard. That's what a work capacity evaluation does. I mean, for instance, a doctor in Holland or a doctor in Port Huron, they give their opinion. And what you need is something like a thermometer. Like, you have to have 98.6. Okay, you're all right.
I see.
And that's what a work capacity evaluation has, some sort of it has something, a reference point, because if you don't have that, what do you got to compare it to something.
Sure, like a yardstick.
Yeah, exactly. And there is none in medical evaluation. It's an evaluation by a professional. It's given his or her opinion on what is happening with that person.
Okay, very good. We're going to take a short break now. We'll be right back with more of Safety Matters.
These days, the media seems to move faster than ever. No sooner does something happen than the TV cameras are there covering it. There before almost anyone else. Almost. Please support the American Red Cross. The need is real. The time is now. Help can't wait.
back again with Ron Smolarski on Beacon Rehab talking about work capacity evaluations. Ron, under the ADA, Michigan handicappers, and workers' comp considerations, can a medical examination disqualify a person currently able to do essential job functions?
If it's job specific, that's the only, and that means the evaluation has to be job specific, and then you also have to look at the essential functions of the job. Can the man do the essential functions of the job? That's really the criteria.
Okay, and in the...
Now that's dealing with ADA, Michigan Handicappers Act. Workers' comp really doesn't care about that. All they really care about is they feel they're just asking for an opinion, the doctor's opinion, what the person can do.
Sure.
So there's a little conflict there, and one law doesn't really request something that's a lot more elaborate in terms of giving more of a measurement.
And an employer really is not being confrontational. He just needs that person back to work to do a job so that he can do his job reasonably well, so that he can make a reasonable profit off of that person's efforts as a worker. And I guess that's a little bit of the consideration too, isn't it?
Well, that's it, but of course the employer is concerned about liability too. I mean, if he's got a workers' comp claim going against him, he wants to get rid of that claim. If he feels that person's going to be a troublemaker and it's going to cost him a lot of money in terms of settlement or whatever, he doesn't want him there. But on the same token, that person has certain rights too. If he knows he can do the job and he can do the essential functions of the job, and he also knows maybe that possibly modifying that job, then that might be a little bit of a conflict there.
Okay, and I would imagine that the employer also is considering this greater risk of future injury, absenteeism, or possible cause of future workers' compensation. So he really, in a sense, is torn between. He has a duty to that worker to provide the best treatment so he can come back to work. But he also, when he does come back to work, doesn't want him to re-injure himself.
Right. And so that's why it's important to have someone in a system, say someone in a rehab field, to make sure that he's going to be placed in a job that's within his capabilities. But the doctor or the therapist or the employer can't speculate that these things might happen. It has to be, again, there has to be direct threat. You can't just say, well, this might happen down the road 6 months from now, and so I'm not going to take the chance. I think the important thing for the employer is to talk with the individual and find out what's needed for that guy to do that job he feels in order to be able to work at a sustained rate and a competitive rate and within his capacities.
That's interesting. Again, you keep mentioning that, but that's worthwhile remembering. Sustained rate and competitive rate, because competitive means that he's making money for the employer.
Right.
And sustained rate means that he is able to sustain some rate of work, and then that sustained rate has to match the competitive rate at least, so that he can be at a successful...
Yeah, I think it's very important, because I think many times people go to say a therapist and they talk about maximum lift. Well, if you did maximum lifts all day long, you wouldn't be able to work at a sustained rate.
Right.
I could maybe lift 100 pounds, but I don't think I could lift 100 pounds all day long. I think what's important to know is how much can I lift at a competitive rate and be able to work 8-hour day,
right,
with breaks and lunches and 5 days a week. That's the important thing.
Sure. Who were the first people to develop and design these work capacity evaluations?
Well, vocational evaluators developed and designed work capacity equipment 10 years prior to anyone else even jumping into the field. Although primarily now you have a lot of occupational therapists and physical therapists doing these types of evaluations, because they're connected to hospitals that have the money to purchase the type of equipment that's needed.
Okay. What does lifting measure, and what's the critical component of a work capacity evaluation? And if we're being repetitive, I think that's good, because I think we need to drive home some of these ideas for our viewers.
Well, there's the main component of strength is, for instance, is the range of motion, strength, and pace. That's the that's the main things that you're evaluating in a work capacity evaluation. And a critical component is really the pace, because that's, again, we're talking about competitiveness. Can the person work at a competitive rate? Is he making so many gidgets per hour, or flipping that many, or making X amount of pizzas? You know, that's really what you were talking about before. Is that man or lady going to make a profit for this employer? Because
Sure.
the bottom line, if you can't make them a profit, what good is it? You know.
That's right.
Yeah.
And I guess that's where, again, this blend between employer and the employee and his treating physician is important, because then the balance or possible changes to a person's work might be something that the employer could accommodate if he could do so reasonably and still have this be a productive employee. But at the same time, he doesn't want to set a work precedent either, because he might be then considering down the road other employees seeking the same relief. And so I think that that's where the employer has to give some deliberation to whether he can modify a person's work requirements. What is the difference between a test and an activity in work capacity evaluations, and why is it so important?
Well, a test has reliability and validity, and to the common Joe, it doesn't mean a hoot to him, but that's really the meat. Because if you don't have reliability, that means that's like the 98.6. That means you got some kind of measurement, and it means that whatever you test, it's what you're testing, and you test it over and over again, you're going to get the same type of answer. And if just a task, it's just something that someone's able to do, climb a ladder, but you've got nothing to measure to, like, say, a norm. How can a fireman do on this job if he can climb a ladder? Well, we know he can climb a ladder, but that's all we know. We can't compare it to how well he can compare it to all the other firemen in the state of Michigan or the city of Detroit.
Okay. How do we know that a person's providing his or her best effort during a work capacity evaluation? Can you detect changes?
Well, there's several ways, and I think probably the most important way is actually the inconsistencies or consistency of the evaluation. If the individual is not producing consistent values, and you know, I'm measuring constantly. I have a stopwatch. I'm looking at how the range of motion. I'm looking at how much weight the person's able to lift at. But even prior to all that, I use a couple instruments that also indicate to me if the person's giving me full efforts. I use a JMAR, I use a Matheson instrument. These sound technical, but basically what they are, they're indicators to me that prior to my evaluation, the person's telling me what they can do in terms of just very simple things, and if they over-exaggerate, it's going to be very obvious, and I'll confront them on that. Because I'm going to be doing a 3-hour evaluation, I want to be able to know that they're going to be giving my their best, and I want to be able to let them know that I have all sorts of catches throughout my assessment to be able to tell me if that person is being true and honest.
So you let them know in advance. You're not trapping them into anything.
No, I let them know that you know, I said, do your best. You know, if you're experiencing any pain, let me know that. But
sure.
I'm not out here to hurt you. I'm out here to find out what your capacities are.
Okay, that's very good, and I think that's appropriate, and I'm sure that's professional too. OTs and PTs talk about maximum lift. How can this type of assessment be tied into the ADA and Michigan Handicappers Act?
Well, it can't. I mean, I'm sure it has a useful information to maybe the physician and the therapist in terms of how well they're improving on their therapy, because it's telling them if the person's able to get to a certain maximum lift. But in terms of the ADA or the Michigan Handicappers Act, we're getting back to the job-specific evaluation. And that means, can the person do the activities or task at a competitive rate and sustained rate that the job requires? And a maximum lift or a maximum whatever they're evaluating isn't going to provide that.
Okay. What advice, if you were to give it to our viewers, would you give, if there were perhaps 3 or 4 things that they should use as yardsticks or as detection devices to cause them to talk with their physician about some additional testing, words that might be beneficial? In other words, if it's just an IME evaluation, should they suggest to the physician a physiatrist, for example?
Well, they can most definitely discuss that with their treating physician. The physiatrist is one of the doctors that is that is taught in medical school how to prescribe to different types of therapies. I think some of the important things to be aware of is, one, if the evaluation that's making a determination for them is, let's just say they're disabled, if they can or cannot return to work, is that evaluation job specific? Now that's a very important term, and they have to be able to state that. And if it is, there should be some reliability and validity, and ask them to see the reliability and validity of that particular assessment.
Okay.
There should be some type of pace rate. I mean, what kind of competitive rate do they have to be able to work, and have to see the standards, see if the standards are compared with U.S. government data.
Okay.
That would be another important variable, and I think it's a little bit difficult, but they'd have to refer to maybe a vocational evaluator to assist them with that to determine if the placement is accurate. If the reporting that is being made, if it's consistent, and that's kind of difficult. That's what the courts will look at. Sometimes attorneys will look at to see if that professional is always consistent in their reporting, or that they change in who hires them. And I would assume that there's got to be some written record if they really wanted to research it.
Okay. Well, very good. Ron Smolarski of Beacon Rehab, and I'm sure that if people want to call you directly, if they have questions, they can do that also, and of course we would encourage that. And again, you're going to meet with the folks in Lansing, which I think is commendable on you and your organization. We want to thank you folks again for joining in on Safety Matters, and we hope to see you again. Thank you for watching.